Welcome back. Nasal congestion is a condition we've all experienced at some point or another throughout our lives, and thankfully there are procedures that can help. Joining us now is Dr. Akash Anand with GNO Snoring and Sinus and patient Carol Ludwig. Welcome.
Thank you so much for having us.
Of course, welcome back, I should say.
That's right, that's right. We enjoyed it our first time.
Okay, so tell me about nasal congestion. What is it exactly?
So nasal congestion is essentially inflammation of the nasal mucosa, and ultimately the main structure here is the turbinate. These are structures that congest and decongest. We've all experienced it at times. And ultimately what they do is they provide humidification for air to flow. That's why you and I, all of us, can actually breathe through our nose and never ever dry out. They're working, and they can also cause congestion at times too. I
see. Okay. So are there other causes for nasal congestion?
There are. So there's multiple causes. So most of us experience it in the winter. For instance, when it's cold outside, the cold, dry air has to get humidified, so those turbinates congest. There's other factors too. Medication like Afrin, for instance. Pregnancy can cause it. We see a lot of patients in their third trimester. The surge in estrogen causes a lot of women to be very, very congested. And then, of course, allergies are a notorious cause for congestion as well.
Especially here in Louisiana.
Definitely in Southeast Louisiana as well.
Okay, so how is nasal congestion treated?
It can be treated a number of ways. For most of us, we just take some medication and we're pretty much taken care of. An antihistamine, sprays in the nose, but there's a small subset of patients that just don't get any relief from this. And you can imagine when you're stuffy, imagine somebody else that's just chronically congested. They're breathing through their mouth.
Terrible.
When they lay down to sleep at night, it's difficult. And they also have this nagging post-nasal drip. So those are the constellation of symptoms that we see for a lot of patients that don't respond to the traditional treatments.
So is there a specific procedure you'd like to chat with about today? Maybe something that worked for Carol?
Definitely. So Carol actually came into our office with chronic nasal congestion and post-nasal drip, in addition to some sinus pressure. And she had tried lots and lots of medications for it, but it just never really improved. And I'll let Carol talk about her symptoms as well.
Sure.
Yeah. Oh, it was awful. And I had the headache all the time. And I had had previous sinus surgeries, and it hadn't been successful.
And one of the things we noticed in Carol's case was her turbinates. Her turbinates were actually overlooked. They were very, very large. If you get a flashlight and just shine it into your nose, you'll definitely see those structures. They're pink and they're fleshy. And so in her case, what we decided to do was, given the lack of relief with medicines like antihistamines and sprays, we actually shrunk it. And over there on the picture, that very, very bottom ridge structure, that is the inferior turbinate.
I see.
What we did was take a probe and insert it into the tissue, and then we essentially heat that tissue. We cauterize it. And by shrinking that tissue, we can see it in real time becoming smaller. And as a result of that, it gives patients just like Carol a significant improvement in nasal airflow. And another thing we've noticed is it really reduces the post-nasal drip. The turbinate, in essence, produces this mucus, this drip, to humidify air. And by shrinking it, we can also reduce that congestion and drip as well.
I see. So before, it sounds like you were pretty miserable, but now you're better.
All the time. I'm so glad, so thankful I walked in to his office that day.
And we're very appreciative that you came by as well. But ultimately, the main thing is, for many patients that suffer from postnasal drip and congestion, it can be treated when essentially traditional medications just don't help.
Sure. So Carol, tell us more about your personal experience. I mean, maybe just from kind of like point A to point B to point C. I mean, what was that transition like for you?
Oh, it was wonderful. After I'd been to see him, and you don't feel anything. He does it in his office, and it's amazing because they deaden it, and he goes in, and it's a very simple procedure. But then I can breathe. I'm not mouth breathing. I'm getting along a lot better, and the headaches are gone.
Wonderful.
So it's great.
So I can't imagine. I mean, especially at night, does this help with your sleeping at all?
Oh,
or?
Yes, because I'm not mouth breathing, and I can actually, and I always had to sit propped up at night. So now I'm just doing my usual.
Okay. So other than the headaches and sleeping, I mean, how else has this improved your quality of life?
Oh, it's wonderful. I'm not using inhalers. I'm not using, because I had infection that he found trapped up there and triggered asthma. So when he found that, I haven't used asthma medication in about 4 years now.
And she brings up a real good point. You know, this is a unified airway. So when patients have allergies, when it's in the nasal region, we call reactive airway disease allergies. When it's in the lungs, we call it asthma. So what she's alluding to is a connection between the nose and the rest of the airway. When you really turn down that inflammation, it can extend into other parts of the body too. And so ultimately, she also alluded to a very important point. When patients lay down, we all get more congested. But a patient like Miss Ludwig or anybody else with chronic congestion, they'll notice it a lot worse and they'll sleep propped up on a pillow to breathe better too.
I see. Okay. So anything else about, I mean, just
It was
being
life-
congested? Are there any other tips for people? I mean, maybe-
Definitely. For most people with simple congestion, you can kind of ride through it if it's seasonal. Of course, if it's a little bit more difficult, then you can go to your local Walgreens or CVS and get an antihistamine, Claritin, Zyrtec. Saltwater sprays are excellent. They're non-medicated and they do provide a great degree of relief. When those don't work, you can get steroid sprays like Flonase, for instance. When these things don't work and it's a recurring problem and it's chronic, and most importantly, it's affecting your quality of life, your mouth breathing, you're waking up in the morning with a dry mouth, you've got that constant throat clearing, then it's time to see somebody for it and see just what else is going on, and more importantly, if it can be treated.
All right. Thank you, Doctor.
Oh,
thank
thank
you,
you
Carol,
so
so
much.
much.
Thank you.
All right, to learn more about GNO Snoring and Sinus, you can head to their website, gnosnoring.com. And of course, there's much more to come on Great Day after the break, so make sure you stick with us. We'll be right back.